mentally, physically. And then both of them are pretty much back to full sport. So how was it getting back into sport? How, mentally, was it tough to be like, oh, I'm going to start hitting jumps again on the skis or the snowboard or getting back on my bike? We're just going to kind of go through that. So we kind of want to be interactive. So if you guys can, just chat me questions, we'll just fill them in as we go. And then I think Jill will also be helping with questions as well. So maybe first, let's have Robin just kind of let us know what happened, like kind of a little bit of your history, how you hurt yourself, and then going in to kind of see Dr. Cunningham and kind of figuring out that you needed surgery. And then we'll go to Pat for the same thing. We'll have Dr. Cunningham kind of talk about each case a little bit.
Sure. Hello, everyone. My name's Robin Kissel. I am a snowboarder. I blew my ACL last in February of 2019. It was the second time I'd injured my knee, and I did it this time by knuckling a larger jump. I was pretty convinced that it wasn't an ACL this time because the second ACL tear felt incredibly different than the first ACL tear. So I didn't actually see Dr. Cunningham until just about a month after the initial injury. And I went to Dr. Cunningham based on referrals from friends who had recently had the same surgery that I was going to have. And then I had also worked with Dr. Janes many years before in my first ACL repair. And he also referred Dr. Cunningham. So I went to go see Dr. Cunningham about a month after the injury, found out it was an ACL again with quite a bit more damage than I did the first time. And it was going to be a two-step process. I wasn't convinced that I needed an ACL surgery and I could survive and continue my lifestyle without an ACL. So I spoke with Dr. Cunningham pretty thoroughly about what my options were. And I took about a week to think about getting my ACL repaired with the recovery and going back through the healing process again. And then I did decide to go through it. I had two-step surgery. I had bone grafting done in April of 2019, and then I had my ACL revision via quad graft done in August of 2019. And then I ended up choosing Avalanche physical therapy, in particular, working with Josh via a referral as well from one of my friends who I had met through the rec center, and she and her entire family had gone to Josh, and she said, if you want to get back to your normal lifestyle, this is your guy. So that's kind of my quick story.
Thanks, Robin. Appreciate that too. Pat, you want to give a little bit of history on yours as well?
Yeah, definitely. This was definitely a really tough one for me. I blew both of them at the same time. Never did that. Always kind of had one and was like, oh yeah, it's an ACL or a meniscus or this or that. So it's kind of an easy cookie to swallow, but having two and then having to figure out the timing with getting them both done at the same time or getting one done and then later on, and finding that time to be able to get the rehab done and just be away from work and away from the sports that we love. So it was definitely rough, but just kind of got to take it for what it is and know that you got to pay to play and dig deep and just kind of find that tough guy bone, I guess, or tough girl bone that you need to find during hard times like that. And it was 2018 December when I did it, and then I had my surgery 2019 in the spring. And then I did my ACL surgery first. Luckily, it was just the ACL and slight meniscus cleanup. And then it was 3 months later that I had my right meniscus done. And then Uller graced us with 20 inches of snow. So that was comical to add in there. But yeah, once I was able to kind of get the schedule figured out and just kind of do all the planning and everything that comes along with it, it's not as bad as it's not it's not the worst thing in the world, you know. Anyone can bounce back off of it. It's just kind of up to yourself on your rehab regimen and how bad you really want to get back to it. But yeah, 2 knees, 1 year. It was definitely learning experience for sure.
Right, and we'll get into more of the rehab too as well. Dr. Cunningham, do you mind kind of getting into, just what you saw in both of them and kind of like what you go through when you see what you think is an ACL, or do you get an MRI for it, and then all that good stuff, and how you kind of look at it?
Yeah, I think, people give that classic history, especially with skiing, or snowboarding, that there's a certain, obviously we hear the dreaded pop story. People report, hey, I heard a pop, I landed in the back seat, heard a pop, that sort of thing, or flat landing on a snowboard. That's kind of your classic, I would say. Again, Robin was a little different because she had a prior ACL, so it's going to feel different when you tear an ACL graft versus your original ACL. Your original ACL is just so much more vascular that you're going to fill your knee with blood, and it's a different feeling than if you tear a graft typically. But no, patients come into the office and typically will give that sort of history, though. If it's a first-time ACL, felt a pop, had immediate pain, I felt unstable. People oftentimes will say, I tried to put my ski back on or my snowboard back on and tried to take a turn, and my knee gave out again, and then I knew that I couldn't get myself down the hill and I had to take the sled, or I, slowly got myself down the hill. Then they'll find their way oftentimes in to see me in the office. And we just get that history first of all. And from the history, you can glean a lot of important details. And then a physical exam is key, just examining the knee and always comparing it to the other knee. And especially if the other knee is normal, we can feel laxity in that affected knee and do certain tests to determine if it's just the ACL or if it's the MCL, because the MCL ACL is a common pattern, especially with snow sports. And then typically we get an x-ray just to make sure we're not missing a fracture. And plus the insurance companies typically won't approve an MRI without an x-ray, so we get the x-ray. And then oftentimes an MRI scan, because an MRI, we can see all the soft tissues in the knee. We see the bone too, but we see all the soft tissues like the ligaments, the meniscus, the cartilage. And then sit down and, oftentimes have to break that bad news to folks that they had an ACL tear, and then get into what the surgery is, what the recovery is. With both Robin and Pat, they're both super active. They're on the hill a lot. And in that active of a patient, we definitely want to, one can live without an ACL, especially if someone said, that's it, I'm never going to ski or snowboard again. I'm just going to ride my bike and do some walking and hit the gym. I mean, you can do okay without an ACL, but most of the patients that live in our locations don't want to give up those activities, especially cutting and pivoting sports. So then it's ACL reconstruction surgery. And the first discussion we have is whether we would use a tendon graft from the patient or from a donor. I'm not a big fan of donor tendon ACLs just because they do tear or stretch at a much higher rate than if we use people's own tendon. And so therefore, people's own tendon, it really comes down to 3 choices: whether we use the central third of one's patellar tendon, 2 of the hamstring tendons, or a piece of the quadricep tendon. And I've been doing this for nearly 18 years. And the first 10 years, I did a lot of hamstring grafts, and they work well, but they're oftentimes a little smaller than we like. And in the last 7 years, I've used mainly just quad tendon because it's such a big, beefy graft. And the morbidity, meaning the side effects, let's say, of taking that tendon are very, very low compared to other tendon grafts. So that's really been my go-to graft. And I work with some of the ski team US athletes, and if one of them tore their ACL, I would definitely use a quad tendon graft. And Josh, I can get into details on surgeries, but I guess just a couple points in relationship to Robin and Pat. Robin, because she had a prior ACL, what can happen sometimes is the tunnels that we create in the bone to accept the graft can expand over time. And we don't want to put a new graft into a loose socket because it just won't grow in well, and then it could re-tear. And then oftentimes the tunnels can even move a little bit, and they're not in a perfect location in the knee. And then techniques have changed. And so I think we're much better now at placing an ACL perfectly in the knee where it once lived versus we were 15 years ago. So in Robin's case, I just said, we don't want to take shortcuts. We got to bone graft you, unfortunately, come back in 4 months and then do your new ACL. And that's what we did. On Pat's left knee, we basically, it was just a first-time ACL with some meniscus work. So it didn't have to do that 2-stage type procedure. So, and I'll probably cut myself off there. I'm happy to answer technical questions if people have them, or we can just get right into the rehab aspects.
Perfect. Thanks, Dr. Cunningham. Yeah, that was the interesting thing with Robin. So I actually saw Robin after the bone graft, and you go through the process of getting her back, getting her strong. She was riding her bike again, and then she has to go for another surgery. So, Robin, how was that with that kind of emotional roller coaster where, I'm getting better, but in the back of your mind, you're like, I'm just getting better so I can have another surgery. And then you kind of go back to square one. What was that like? And, how did you kind of push through those type of things? Because, you're active. You're always on the mountain. You work at Vail. So, you probably get hundreds of days on the mountain, and now you weren't allowed to this past winter.
Sure. I think that it was a little easier going into it because I knew it was going to be a 2-stage process. I knew that when I tore my ACL this time and it hurt, I knew that my season was probably over in February. So I'd already kind of retired the previous winter knowing that I wasn't going to be back on snow. After the bone grafting, I was still able to do a lot of things. I was still able to do more mellow biking. I had to take my clipless pedals off, but aside from that, I could still use flat pedals. So I was still able to get a lot of biking in throughout the summer, which helped with kind of that mental aspect. And for me, it was really, really motivating to know that I needed to stay strong and maybe even get slightly stronger before the ACL surgery. So for me, that was a big motivation to continue with sort of rehab / prehab for the ACL. What was more challenging for me was I had been training to do a trail half marathon, the Pikes Peak Ascent. So it's a pretty challenging uphill trail marathon, and that was taken away. And I had been training for 2 years for that marathon. So that was kind of more of that mental struggle than knowing I was going to have to go back into surgery. So the way that I dealt with that is I replaced running with more lifting and then more biking as well. So I had some other outlets. But there were still definitely days that would have, like perfect running weather days, there are definitely tears for sure. I have a great support system as far as my friends and family, which really helped. And then Dr. Cunningham and Josh, you guys were also awesome with sort of that emotional support piece. Josh, I know you saw a few tears for me throughout the roller coaster as well. But just knowing that I was in good hands of very talented professionals helped to kind of push through that piece as well.
And Pat, when you started like coming back, you've been a pro skier for a while and you're trying to kind of get back, and in the pro skiing world, you're a little older for that. So it's even harder to be like, okay, I need to get back into that game. When you first started from your recovery of ACL, what was going through your head? Were you like, all right, I'm still going to ski obviously after this, but I might not hit it as hard as I used to? Or were you like, no, I'm extra motivated, I'm coming back, I'm going to be better than I ever have been before? Still muted, Pat. There you go.
So I was definitely as hungry as I could have been, 120%, fully knew exactly what I wanted to do when I came back and how I needed to do it. So being 33 now was definitely like, all right, I'm probably not going to lock down the Monster Energy or the Red Bull contract, but that's not why I started doing this. And basically the stoke and the feeling and everything that comes along with a great day of sports or skiing or what have you is basically all I really needed was to just, first of all, I went home to my mom's house for 3 months and I got kind of sick of her and she got kind of sick of me for a little bit. So I used that motivation to kind of wrap up the whole rehab thing and just really buckled down, and I quit drinking alcohol 2 years ago. This spring or this fall, this ski season, 2019 fall, I got out of doing the rehab, and then you cleared me for CrossFit. So it was like boom, bomb. The next thing I'm doing is getting right into CrossFit. I got a road bike maybe in the middle of the summer. Got basically moved from back home, living with my mom for a couple months to get the rehab going. Rented a condo with a few friends that had already lived there, right across the street from the rec center, basically fully because I wanted to take it as serious as I could, be the first one at the gym, be at PT as much as I could, be on the bike path, and just kind of see how my body felt while I had the nutrition, the working out, the sobriety, and everything like that into effect. And holy, it was the best season I've ever had. I can't even believe that I had 2 knee surgeries last spring, and just seeing where I was at in January, and then being able to see the shots that I got a few weeks back at an undisclosed location. I couldn't believe it. It was just holy, it was like winning the lottery almost. It was just oh my God, wow. I really put my head down, and there was a couple points in the rehab where I was my quad sore, this is sore, is it? Or maybe the third day skiing when I accidentally hit the jump filming my buddy and you yelled at me, Josh. But yeah, it was definitely, it's an up and down type of thing, but you gotta find the positive friends that are around you and let them reinstate that positivity in you and that inspiration, and really just go from there and know what you want to do and put 120% into it.
Perfect. Yeah, I mean, kind of jumping ahead a little bit, was kind of interesting because we didn't clear you to start skiing again until January, and then you have a Vimeo video that's coming out next year, and all the shots that you were able to get, even though you weren't cleared until January, especially with the mountain shutting down. You couldn't go to the resorts. You just had to find a bunch of backcountry things to get into. But with Robin, when you came to me pretty much right after surgery, and usually, if you're staying in Colorado, Dr. Cunningham, or even if you're not, he wants you to kind of, get into PT, in the first couple of days after surgery, usually about 3 days. And our goals are, let's get that range of motion back. If there's no meniscus problems, let's start trying to get the gait a little better with your brace on. And then on top of that, we got to get that quad firing again. So after your injury, your quad just shuts down. It's too much trauma, it just shuts down. And if that quad doesn't start firing, it can give out during gait. You just don't have a lot of control getting into your leg in the bed. And Robin, did you, when you first started therapy after the 2 surgeries, what was your hardest part? Was it getting your motion back? Was it getting your quad to fire? What was kind of the things you had to struggle with initially?
I think the 2 biggest things that kind of strike me were my first ACL was a cadaver graft, and so it wasn't harvested. And my very first surgery years and years ago, it was just the knee that had to heal, and this time with the quadricep graft, it was a different level of pain that I was mentally prepared for, but then when it actually came down to it, that level of pain that came with having to heal not only the knee but the graft side as well was a bit of a challenge at the beginning. And then the other piece that was I think one of the hardest parts about the initial PT process was getting my flexion back. Extension came back pretty quickly, but I felt for 3 weeks I was stuck at a pretty painful spot in the flexion of my knee, and Josh would have to really get in there and it felt like hammer on that knee to start to get that quad to release to get that flexion back. But in the relative of being in PT, I just got cleared from PT a month ago. So I had been in PT from April of 2018 until May of 2020. So in the realm of the length of time I was in PT, that 3 weeks of not having that flexion was pretty minimal in that healing process.
And then going back to you, Pat, so, you had PT in New York and you came to us like 3 months out. And so around 3 months, you can really start kind of pushing strength, start getting back to, some lighter activities. When you were in New York, were you still doing the PT thing? Were you just kind of doing things on your own, hang out with your mom, or kind of how did you kind of push it?
Yeah, I did. I enlisted in PT out there. I actually went to the Frisco Vail-Summit or Avalanche physical therapy. I think I only got seen there 2 or 3 times before getting back to New York. And then once I got back to New York, I got situated with a couple physical therapists out there at a clinic and went through with that. And then once I came back out to Colorado, I was like, I'm back. This is awesome. No more New York State. But yeah, it's the most important thing. I heard actually a guy in physical therapy in New York say, oh yeah, 3 months, like a regular person will usually be done with physical therapy after that. And I looked at him, I was like, wait, what? Like, people injure themselves, get a surgery done, and then they don't take the physical therapy serious? Like, how can you treat your castle like that? Or, but yeah, it just kind of goes to show what happens in other areas that aren't as active. And just stoked to be out here surrounded by awesome PT people and awesome peers like Robin. And yeah, just stoked to be living in Colorado, that's for sure.
And it does kind of make our job a little easier as PTs and probably Dr. Cunningham would say even as surgeons as well, is because everyone here is so motivated. And then in my past, I've worked in all over the country. I worked in probably 5 different states, and to have such active patient population, you really make our job easier. And we're more of, we have to slow you down. And both Pat and Robin would always come in saying, hey, can I do this now? Can I do this? And like, no, don't do it yet. Let's let things heal. And you're just kind of slowly pushing them. Kind of like Pat was talking about when he accidentally hit a jump. And it's like, no, Pat, don't get into that quite yet. And the reason is you want everything to sit and you want it to stick. You don't want to get a little bit of fun and then the worst thing happens and you have to go back and then you got to see Dr. Cunningham again. And, he's got to do another surgery for you guys and you just go back to square one. And obviously every time that you go back into the knee, it's going to be a little harder than the first time. And that's one reason Robin was with us so long. She had 2 surgeries, but it was also the 3rd surgery on that knee in the 2nd ACL. So it takes a little longer. And then with Pat, what he was talking about, so he came to see me and then all of a sudden we're moving pretty strong. He's getting better. We're starting to get into some more dynamic things. And then he has to do his meniscus on his other leg. So Pat, how was that when we were together and you were getting real strong and then all of a sudden we had to really, quiet things down a little bit because of the other knee?
It was definitely pretty wild going from a quad tendon graft to just a scope, because it had been probably 5 years since my last scope. And the most painful part was the IV going in my arm. I couldn't believe it. It was a amazing, clean, quick procedure. Leading up to it, the day before, I was like, oh my God, really? I got to go through all of this again? And I just tried to not think about it. Just know I had to get it done and do it. And figured out a ride over there. And yeah, it definitely, it was a tough one to swallow, because I was in the back of my head before I had set up all the doctor's office meetings and the x-rays and all that stuff and the CAT scans. I was like, oh, this will be, it is what it is. I'll just get both done at the same time and save time, and thank God I didn't do that. That would have been rough. But yeah, there's definitely positive to the negative, and yeah, you're going to fall down, get bruised, but just going to get back up and get stronger.
Perfect. Dr. Cunningham, do you have any, like for people that are wondering that are out there, do you have kind of like guidelines of, okay, at 3 months we can start X, or I think they might come back to sport at this time? I mean, everyone's different. All surgeons are different. I always tell patients, like, don't just, compare yourself to your buddy who had ACL surgery because, you might have had 2 surgeries, they had a meniscus involved, MCL, whatever. But general guidelines of kind of how things progress.
Yeah, so let's say just straight quad ACL, no meniscus work, no significant arthritis, not a redo like a Robin case. Patients typically, go home the same day. I tell people you're going to be in a hinged knee brace with your knee held straight for usually the first 2 weeks or so, maybe 3, until your quad wakes up and Josh says, hey, yeah, her quad has woken up and we can do, they can do a straight leg raise and we can discontinue the brace and restore your normal walking gait. We get you in PT, as Josh said, right away. Even the next day is fine, or within a couple days, definitely. Get you spinning on a stationary bike as soon as we can, within a few days if possible. But some people don't get adequate motion to get around on the pedals even until 2 weeks or so. Just whether we take a quad graft or a patellar tendon graft, anything from the extensor mechanism can slow that ability, as Robin said, to get your flexion to get around on the bike. But we get it eventually. But when we can get around on a bike, we're initially spinning. The first 6 weeks is really just getting the swelling down so that we can maximize the range of motion, getting the pain under control in that first week or 2. We're using a nerve block. The anesthesiologists out here are great. They place a nerve block that now lasts for even a couple of days. So in the first few days, patients are not having a lot of pain because the nerve block is doing a lot of the work at relieving pain. At 6 weeks or so, I tell people, okay, your quad has healed enough that we can start to put some resistance across the quad. So Josh is now going to start some gentle strengthening stuff. We're going to add some resistance to the bike. You can get in a pool and start to kick in a pool a little bit, walk against the resistance of the water, aqua jog, things like that. And then, I'd let someone then get on a bike outdoors, probably around week 10 to 12 or something like that after a straightforward quad ACL, and they can start to ride on the flats. As Robin alluded to, maybe not the clips right away, but after, by 3.5, 4 months, you could use that. Swinging a golf club, short game stuff at 3 months, driver at 4.5 months, light hiking, I should say jogging at around 4 months. We'll start to do some jogging, some light hiking subsequent to that, usually with poles, especially coming downhill. I tell people you can power uphill, just take it easy coming down. Just don't want you to slip on some loose gravel, twist your knee. And then, at 6 months, if it was a winter, I'd let someone snowshoe, maybe some Nordic skiing. But to get back to, snowboarding, skiing after a straightforward ACL, we used to try 6 months. And honestly, there was a pretty high re-tear rate. I shouldn't say re-tear rate. People, there was a concerning amount of people that would tear their graft or stretch their graft. And so it's really 8 months to get cleared to ski or snowboard. And that depends on a sports test with Josh. We just want to see on a sports test, he'd compare your strength on the affected side to the other side. And we want it within 90% of normal to let you do those sorts of things. And if you pass it at 8 months, we let you do that. I get people in a sports brace for the first year back to those activities. And I say, you don't have to wear it the rest of your life. Just give me 1 year in that brace when you're cutting and pivoting. But some people don't get there at 8 months. Some people it's 9. So even sometimes longer. Everyone's a little different. And that's what I outlined is kind of the average patient. Some people are a little faster, some a little slower, but.
Thanks, Dr. Cunningham. So we had a question over from Casey. He's kind of asking me, like, how do I personally help patients with their emotional and mental problems, that come up because, we always think of it as just a physical. It's like, all right, my knee doesn't work. I get my knee to work and I'm back at it. I've so far, knock on wood, have been lucky enough not to have an ACL repair or anything like that or reconstruction, but I have treated a lot. And so basically for me personally, I try to approach each person individually and try to get to know them personally. Sadly for them, they're with me for a while. Especially if insurance allows it. So we might as well get to know each other. And, I know a lot about Pat and Robin personally. We still talk to each other, even though they're done with therapy. And I've helped Pat build a few jumps this winter in the backcountry. But, you kind of make that connection and kind of see what gets them excited. And and let them know like it's going to be okay. I tell a lot of people, look for the small goals. Like, oh, look, I did a straight leg raise with my legs straight. I got into bed by myself. I was able to, walk without a limp this time. And those little goals help get you through it, because it's a long process. If you keep thinking, oh, I'm not on the mountain yet, that's going to be a long recovery. So you kind of have to, look for those small goals. And, one of the biggest goals here is getting around the bicycle, the stationary bike, for the first time. It's everyone, has a knee injury, they kind of remember that day where they got around the bike. Dr. Cunningham was talking about too, trying different things. So I work here at the rec center, so I have access to the pool. Robin got in the pool with me a lot. We have access to the weight room. Even now, right now during COVID, the rec center is open. It's appointment only, but I still do my aquatic class on Thursday with a limited amount of people. And then also we can still go into the weight room. The weight room's not very crowded right now, so it's kind of nice to be able to kind of get to the machines or the turf field. And so it just adds a little different component and keeps it from being boring. People are going to see PT 2 or 3 times a week for a while. They need a little variety. You want to keep it kind of fun for them. PT can only be but so fun, I imagine. But Pat or Robin, whichever one wants to answer first, how did that work with you guys? The emotional, the mental part of it. Usually, your day off, you're probably out on the mountain with your friends. Now your friends are all gone, so you're potentially by yourself hanging out. How did you guys deal with that? And then what did you expect from like Dr. Cunningham and myself, like, for helping you through some of those times where you're like, oh, they're just the professionals, they'll take care of my physical part and I'll rely on my family for the rest of it? Or what do you guys think?
Like you were saying, Josh, I definitely relied on like my entire network system to kind of get through those challenging emotional and mental pieces. I really learned to redefine success. Picked back up like Nordic skiing, so I was still outside. Picked back up snowshoeing, so I was still outside like in the snow when my friends were on the mountain. So there were some other like replacement pieces. As far as support from Josh and Dr. Cunningham, I spent a lot of time with Josh. I went to PT at least 2 times a week, again, from April of 2019 until last month. So I felt really comfortable kind of sharing a lot of those really challenging moments. And Josh was really good about creating a really comfortable place to be able to do that and have some positive words around that as well. And then with my checkups with Dr. Cunningham and his team, they're an incredibly sympathetic team. They always, going into Dr. Cunningham's office, I always felt like the team had an investment in my healing as well. I wasn't just like the next ACL that Dr. Cunningham has seen 9 million of these. I felt like there was a vested interest in getting better. So that definitely helped with that sort of emotional and mental comfort for my side.
Do you have anything to add with like the emotional, mental part for your recovery?
Yeah, definitely. You just want to make sure you don't get caught up with spreading yourself too thin, like your main focus in life is your rehab and getting back to 120%. And for me, it was buy a nice pair of muck boots with the anti-slip sole and go to work every single day, all day long, come home and just stay focused on that end goal of I'm taking January, February, March, April off and I'm going skiing. And there wasn't a question in my mind in January it was CrossFit at 6 a.m. I actually started getting into hot yoga to make sure could take the hits and the tweaks and this and that. And thankfully got linked up with Asterisk knee braces. They signed me to a 1-year deal and couldn't be more thankful for that company responding back to my proposal and just making sure that you're around positive, inspirational people that kind of have the same goals as you and want to push you and motivate you and see you exceed your true talent, and want to thank you, Josh, big time for just being that positive motivation in me. I remember multiple days in physical therapy, I was just like sitting there like, I'm 32 years old. Like, what am I doing? I should get a real job for 12 months a year. And then I was just like, oh no, like there's no way I can do that. I got to keep doing this. There's no like here, there, this, that, you know. What makes me happy is skiing and working. So you kept me motivated and focused on the end goal, and just, yeah, wanted to thank you for that one big time.
No problem, Pat. I mean, that's what we got into the business for. I mean, we're here to help you guys out, and you know, for me at least, it's very exciting to see you guys after the fact. So I love when people just stop in and like, hey man, I just did this jump, or I just did this, or I'm doing things that I haven't done in a long time, or I'm just back to my normal life and I'm not even thinking about my legs anymore. And you know, that's kind of what we look for too, is we all came out here for the same reason. We're all active, and you know, I think luckily I haven't had too many like major injuries that keep me out of doing things, but I think about myself where, you know, if I had an injury, you know, what would I do? Like, I'm always active. I'm doing something, you know, whether it be snowboarding, paddleboarding, hiking, whatever, like I'm out doing something. So, you know, I want to get back to my life. And so that's where I kind of try to put myself in your shoes and try to, you know, help get you guys back to it. Let's go to Robin. So Robin, we've gotten through your quad, you're walking normal, but you're still weak. And for you, we used a lot of dry needling. We got into that to try to really get that quad to fire. And we also used that to kind of work on your incision, because you were having some incision pain for a while. Can you kind of get into that as well, and kind of like with the dry needling? I don't, if you guys don't know about dry needling much, we use the same needles as acupuncturists, but we don't work on meridians and energy flows like they do. So we do completely different things. So you wouldn't want to come see me for acupuncture. But we can use it to kind of help restart the muscles, kind of help get the pain down, relieve trigger points. We'll hook electrical stimulation to it to kind of help get those muscles firing properly as well. Ron, if you want to kind of mention towards that, you know, that more middle of your recovery where you're now starting to get strong, but aren't strong enough yet, and kind of, you know, what that process was like.
For sure. I had some previous experience with dry needling with hip injury, sort of superficial hip injury, and it had been pretty beneficial for that recovery. So when Josh recommended trying dry needling, I definitely jumped on board. We had like 3 kind of go-to patterns depending on where the pain was. And the initial process isn't the most comfortable. If you're good at blocking out pain, like it's pretty easy to just kind of zone out and forget that there's little electrified needles coursing through your muscle. But the part that really, I think, helped to speed up my recovery was Josh tried a technique of dry needling with scar tissue. I was having some scar tissue issues with the graft site. So Josh mentioned a scar tissue technique where he would put the needle pretty much into the scar tissue and then twist it. The process itself is not, again, the most comfortable. It depends on your pain threshold. Sometimes it was fine. I can remember one time I cursed at Josh. Sorry about that, Josh. But it was amazing after the scar tissue sort of twisting dry needling technique. As soon as that needle came out, I felt like I had the range of motion that was sort of being prohibited by that scar tissue. So the immediate result that I felt from the dry needling really helped that scar tissue, and then helping to kind of, again, refire those smaller little muscle fibers in my quads that were having a hard time sort of re-engaging. Dry needling was a huge help in bringing that back and being able to work through some of those pieces that I just didn't feel like I was getting success with.
Thanks, Robin. So Pat, when you were kind of in that same process that we're talking about with Robin now, were you going to the rec center as well, and then also doing CrossFit? Like, how did you supplement your care? Because, you know, you can get better by just doing PT, but, you know, you got to do a lot of homework as well to kind of get back to elite status.
Yeah, definitely. I started to slightly wean off of the rec center just due to the time. I'm the type of person that needs someone kind of in their face, yelling at them, being like, you know, the workouts on the board, I want to watch your form and this and that. So I started to kind of wean off of the rec center just to get that early morning workout, so that it was boom, all right, I'm eating my breakfast on the mountain or in the backcountry, and yeah, in bed by 7 o'clock most nights. But yeah, it was a blessing in disguise for me, for sure. I know it sounds gnarly with two surgeries in one spring there, but it changed my life.
And Pat, so when you got back to sports, so Robin just got discharged a little bit later, and you know she hadn't been really able to snowboard unless she had since our last talk to Oregon or anything. But when you were getting back into sport and skiing and all, were you pretty hesitant? Were you like, oh, I don't know if I want to hit these jumps. I don't know. You know, typically for us, we'll tell you to go back and start with like greens and blues, get a feel for it, then go to easy bumps. And is that kind of what you did, or did you just go into it? How did it work? And then tell us a little bit about how the rest of your winter went with you. And like, I know you and Tanner Hall were working a lot together on shooting videos and all that stuff. Like, how did you go from not Hall to going to status?
So basically, this is where the age comes into play to help me, because I've definitely had a surgery and then went straight to the streets to try and film an urban handrail or something and instantly got hurt. So basically it was slow down. Don't even think about going to like A-Basin or Keystone or any of that. Don't even pay attention. Worked straight up until January. And then once January started to hit, it started to get pretty cold. It was all right. Let's go get turns in at Copper Mountain. Let's do a lot of skinning. I'd never done as much skinning as I'd done this year, and that was a huge help for me. And just basically living off of how tired my legs were. It was like my goal every day was to just get my legs as tired as I could get them, and get ready for the winter. I would say about mid-February, I felt about 100%. There was still like a few, maybe 2 or 3 little special ways my leg would kind of like tweak, or if I hit a little patch of snow, it would kind of flex a little bit. But yeah, it's all about just setting up a game plan and just initiating on it, and just really going for it, and knowing what you're getting into, and knowing what the consequences are is a big thing, where I think a lot of young kids just are like, oh, my leg's back, my cast is off, like let's just go out there and chuck ourselves again. When you get old, and when you get old, it's tough.
So Amy sent in a question, and she was asking, and I'll go with both of you, but Pat, you're on mute right now, so let's ask you first. What was the hardest exercise you had in PT for your recovery? Did you have something that, I don't know, when we made you do something, you're like, oh, I don't want to do this, or maybe it took you a long time to actually be able to master that, or anything like that? Sorry, you're still muted, Pat.
So the dry needling definitely hurt. I'm super scared of needles. I have been for like mad years, and that hurt really bad, and it helped so much at the same time. So I kind of like got over my own little barrier there with kind of using needles more and doing that. I feel like that helped me a lot with getting my quad back to being able to kind of go for it. I feel like I slightly could have went a little bit harder on the physical therapy in New York, which I felt like it kind of set me back for when I came out here. But once I got out here, I can't think of anything exactly of an exercise, the exact exercise that was tough for me. But definitely the dry needling, and then the good old ACL to the butt. That one is definitely the rough one. Was another rough one for me, but those are just kind of stretches, not exercises.
You mean when I was stretching you, trying to get your butt to your, or your heel to your butt?
Heel to butt. Yep.
Yeah. Yeah, those good times. Good times. Robin, did you have anything that you can remember?
Yes. So in the return to sport test, you have to do a series of jumps. And one of those series of jumps is 3 jumps in a row. So you do it with your unaltered leg, and then you do it with your surgically repaired leg. And it took a lot of practice and a lot of time to learn how to jump on one leg 3 times in a row. I failed my first return to sport test. Actually, I passed that triple jump, but I did fail my first return to sport test, and I had to go back and take a piece of it. But that triple jump I actually questioned Josh if this was really a motion that I needed or if he was just making me do dumb monkey tricks, because it got a little frustrating. But I got it in the end with some practice and some more strength training.
There is research to show that is a useful testing. But that is a tough thing because we make you jump on one leg, and you can kind of get used to jumping up and landing, and that's it, we're done. But now you got to jump, land, explode, and that can be hard to test, or hard to trust your leg. But it's nice when you can start trusting it in somewhere here where we're controlled, and then take that out in the snow and have more confidence that you can kind of get back to what you're doing.
And Josh, just so you know, I have used that in my returning back to trail running. I've definitely appreciated having that. So thank you for making me do it.
Has trail running been good coming back? Are you getting the mileage?
Yeah, definitely. Some days are better than other days. The knee almost always feels great. I had some meniscus work done, but that doesn't really bother with trail running. The quad still gets pretty sore if there is a lot of downhill in the running, but it's coming back. I would have been ready for the trail race this year if they didn't cancel it.
So would both of you say, you're both discharged from therapy? I haven't seen either of you in over a month, Patty even longer. Are you guys just hanging out now, or you're just like, okay, my knee's better, I'm back? Or do you still do like PT type stuff to make sure your leg's strong and ready for all the sports you want to do?
I definitely am still doing a ton of the strength training and PT exercises. On a daily basis, I still do one-legged squats just to kind of help continue to build my quad, and my hips lost a lot of their strength as well. But every day there is some piece of focused PT-like exercise because I know I'll be back on snow and I don't want to have to go through an injury again.
Pat, are you
So?
Oh, go ahead. Sorry.
Yeah, sorry to interrupt there, but yeah, I definitely I ride my road bike in the last couple of weeks, not as much as I'd like, but I definitely am still fully focused on my legs and my quads, and just kind of seeing those muscles from where they were before my surgery, and then where they were during my surgery, and then where they are now. Is I definitely want to keep them where they are now, and whatever I got to do to do that, I'm going to do. So it's definitely, it's the way she goes. You got to pay to play,
That's definitely fair. And it's nice to hear from you guys, just doing all your hard work, and it's nice to see it pay off, and it is a lot of hard work on your recovery. And if you do put in the work in, though, you'll get back to it. And there is research out there that shows that, not everyone gets back to sport. And is that more of a mental? Is it a physical? It's, it's hard to say. You see some people in the pros, like Adrian Peterson, who got back in like 7 months and never missed a beat. And then another guy like RG3, he didn't come back for a few years, and now he's a backup quarterback when he won the Rookie of the Year. And so it's always hard to tell. There's so many different components with it. So I really appreciate you guys coming in and kind of, maybe it's people that might get an ACL surgery down the road. Maybe it's someone that's doing it right now or has had it in the past. And it's kind of nice to kind of see what you guys went through and how you dealt with it. And one, to kind of feel like, you're not alone in this recovery. And sadly, in Summit County especially, there's probably more people than not that have had ACL surgery. Dr. Cunningham is probably the most popular person in Summit and Edwards County. Everyone knows him. But yeah, did you guys have anything else that you wanted, any lasting thoughts from Rob and Pat or Dr. Cunningham of what you guys wanted to share? I figure we'll kind of wrap this up in the next few minutes.
Josh, I was going to ask you one thing. Is there, the one thing I see quite frequently, and I don't know if Robin and Pat, if you guys experience this, but right around month 3 to 4 is kind of a tough time because patients come in and they oftentimes have a lot of patellofemoral pain, kneecap pain, and, pain with squatting or loading the knee like stairs or things like that. And it always seems to be at that point that the muscle imbalances are causing maltracking of the kneecap, but that seems like a tough, transition point. You're, I think, coaching patients and more of an emotional support system than me because my visits are pretty brief, unfortunately. But I don't know. That seems like a tough time because people have been like, oh man, I've been through this 3 or 4 months, and now I'm having this pain on my kneecap. What's going on? That's something I find, and I don't know how common you see it, but that we have to talk people through. That's a difficult time, it seems.
Yeah, I mean that definitely can be, because what typically tends to happen around, depends on what you've had done, but maybe 2 to 3 months, you start feeling really good. You're not there yet, but you start feeling good, and so, around here, when we start feeling good, we just go do stuff and we start doing more and more and more. And I think it just gets overworked, and people don't necessarily think they're overworking. It's like, oh, all I did was I stood on my leg 8 hours at work and I hadn't been to work in 2 months. And that's a lot for that leg. So that leg is obviously a lot weaker. It's been through a lot. And so I think kind of in that zone that you're talking about, Dr. Cunningham, people are finding out their limits. And I tell a lot of people to kind of listen to their body. There's good pain, there's bad pain. Bad pain, I would say, is sharp pinching pain. A dull pain when you're going through it, that can kind of, like at a 2 or 3 out of 10, that can be an okay thing. You're working that leg. But if that dull pain escalates to like a 5 or 6, you need to back off. And, during that time, I feel like people are feeling better overall and maybe don't have a full understanding of what their leg is telling them, or they don't want to listen to it. And they'll kind of push. And it is kind of that kind of roller coaster where feeling good, doing a whole lot of stuff, did too much, I went back down. And then you kind of rest a little bit, change things up a little bit in PT, and we go back up. And it's kind of that, but hopefully you're still going up the whole way. But definitely try to have a lot of conversation, like listen to what your body's telling you, realize that, things that you're going back to that are normal for you isn't normal for this leg right now. It will be eventually, but, you did have major surgery a few months ago. And, we're impatient. We want to get back to everything. So I think that's one of the bigger things. And then once that happens, we can do a few things. So sometimes we'll tape to kind of unload some of that pressure or help with the tracking. Sometimes we'll do the dry needling if the quad's not firing, or it's firing for a certain amount of time and then it gets fatigued, so it stops firing. So we try to help build that endurance. And then a lot of just patient and PT communication. Let me know what's going on, because we don't do the same thing every time. If you're hurting this day, maybe we're just kind of helping relieve that pain. Now you're not hurting, let's kind of push you a little more. And so it kind of, we all have to kind of listen to each other and have a lot of good communication. Hopefully those pains will probably come, but hopefully they don't cause a real setback.
I think what's hard during that time as well, like Josh was talking about the different types of pain, is there were pains that I hadn't felt before. So trying to describe that pain or knowing if it was an okay pain or a not okay pain was really challenging. So just keeping that line of communication with the professionals, I think, is so incredibly important in continuing the healing and not roadblocking at that 4-month sort of time frame.
Yeah, and then I definitely was looking forward to that time because I had a decent amount, or not a decent amount, a lot of pain. I planned that move home and was like, oh yeah, I'll be able to get back there in 7 days. And then a few days later than that, I was like, oh man, I'm still out here in Colorado. Like this pain's, it's pretty painful, but you kind of hear the whispers, oh, it'll go away around this time or that time or this time. And yeah, it was just kind of a built up time that I was like, oh sweet, well this is going to go away at this time, and then I'm going to do this, and then I'm going to get better, and I'm going to be back way sooner than they think. And that was completely the wrong mindset. It was just more of along the lines of, well, day I got into CrossFit, I was like, look, I had both my knees done. Dave helped me out here, and he was like, all right, I got you. We're going to set you up on this mellow little program going on over here. When they're doing this, you're going to do air squats. And then if you're feeling like anything's hurting in your knees, stop doing what you're doing and just come over here and row or do this or do that. And the communication was key for that. And I thank all you guys so much for what you do and the passion that you bring along with it. And yeah, super thankful.
Awesome. Thanks for that. Yeah, anybody else have anything else they kind of want to talk about? It's kind of nice to go through, you know, the very beginning of recovery and see where you guys are at now. But any other lasting tidbits or anything like that?
You know, I think, again, I feel so fortunate because, you know, patients like Robin and Pat are, you know, so fun to work with because they're just so motivated, like you said. And I go to conferences, national conferences, and other, you know, talk to orthopedists that do what I do from other parts of the U.S. or even other countries. And certainly it's a whole different ballgame in terms of having people that are just so motivated to get back to things versus someone who really doesn't have that motivation and drive. And, you know, those docs are really trying to, you know, and the therapists for that matter, trying to, you know, instill that in people for a better outcome. And so it's just great. You know, I feel so fortunate to have patients like you guys, and that's what makes my job so fun. And so thanks for putting this together, Josh.
Yeah, thanks for joining in, everybody. I really appreciate it. Hopefully it was useful for some of the people, you know, watching now. It's been great. It's been great working as a team, and, you know, from working all over the country, Dr. Cummon's exactly right. Just having patients that want to get better just makes our job so much easier, and it helps motivate us too, because we see how motivated you guys are. I was like, well, we don't want to let you down. We gotta keep working with you and keep getting you back to what you need to get to. So yeah, so excited for you guys. Thanks everyone for joining. Really appreciate it. And hopefully we'll do something more like this in the future.